Hello everyone, this is Bob Browner recording update number 18. So the themes for today are more Nebraska hotspots, unfortunately, and what to do when you're in one of these hotspots, and the three common myths I keep hearing about. So the big problem, of course, is that Nebraska is getting multiple hotspots. We started out one of the best in the states. Now we're heading toward the worst, unfortunately. This is cumulative cases over time. This is actually new cases per day, and it's a different way to look at it. So had very few new cases. Now we're actually having some of the most new cases on a population-adjusted basis of any state in the country. The reason, of course, is our meat processing facilities turned out to be our Achilles heel. You can see the hot spots in New York, Atlanta, New Orleans. All of ours. This is the Tyson plants, JBS plant. Here we're closer to my home. We've got the Smithfield plant in Crete, which unfortunately now is spilling over into Lincoln. And so all of our stuff in the middle of the country that's causing us to look the worst is centered around our hot spots, which are our meat processing facilities. This is actually a prison here in Sterling, Colorado, causing it out there. So the problem is in Nebraska, we may actually have small communities that are going to have cases every bit as bad as New York, unfortunately. If you look at New York's percent case positive of about 2.1%, we already have two communities, Sioux City and Dakota County, and Lexington and Dawson County that are above that, and Crete and Grand Island are getting pretty close actually as well. We don't know for sure how the total because we just don't have enough testing at this point. New York actually did do antibody testing on a population level, which is probably the only time you should do antibody testing right now. It's not helpful in an individual level, which we'll talk about in a minute, but they think about 25% of New Yorkers were positive. So there's a chance that these small communities could have fatality rates just as high as New York, unfortunately. Hopefully we don't let it spread around the rest of the state. So I've had this before, and I think we have a tale of two areas of Nebraska. We have areas in Nebraska that are doing pretty well and unfortunately may be opening up too soon. So I think it's too early for churches to open, for example. And we have communities like ours that are still potentially on this exponential growth curve. So we're not even here yet like I hoped we were. So if you look at Lincoln, Nebraska, this is from this morning's update from the health department and on their website. We're in the exponential growth curve here in Lincoln, and we've had 5 to 6 times as many cases this last 2 weeks than we did the prior few weeks. So we are on the exponential growth curve here right now. The other thing that I need to make sure that people understand, I've heard some controversy over should we use ventilator supply as a way to monitor what we do, and the answer is no. Well, we should use it to monitor, but we shouldn't use that as the key thing to make decisions. And the reason why is that the ventilator supply is a trailing indicator. That's something you see 2 to 5 weeks after the infections start. And the reason is the time lag from infection about coronavirus. This is one of the things that's proven and so hard to model is that you get infected, then you get symptoms, maybe a week into it. You may then the hospital on day 10, you may be the ventilator in day 14, and it might take 2 and even 3 weeks sometimes before you either die or live. And so this is causing a huge time lag problem and throwing off a lot of projections. And so one way to look at it is people, I think, are getting a false sense of security when they look at Lincoln's numbers because they say, oh, there's only one death so far. That's a very, very low case fatality rate. Well, it is right now, but if you look at the German case fatality rate 6 weeks ago, that's where it was. Here we are 6 weeks later, they're at 4.2% because of that time lag I just talked about. So if we applied the German case fatality rate, we'd be looking at actually probably likely 20 deaths just from the infections that are already being confirmed. If we use the US case fatality, which is worse, about 6%, we're talking 28 deaths already. So this one is a very falsely reassuring number. So I would not use current ventilator supply as the primary metric. What you should use is the number of infections we're having. Essentially, the amount of ventilators we're in use right now are based on the number of infections we had back here, not the infections we have right now. And so right now we can pretty much assume that the number of ventilators we're going to use 3 to 4 weeks from now is going to be probably 5 to 6 times the many we already have, and that assumes that this doesn't keep going up. And so that would be very much a trailing indicator. So to only look at the amount of ventilators currently being used would be like driving in the rearview mirror. You can drive for a while on a straight road looking only in the rearview mirror, but that assumes the road always stays straight, which it does not. Even in rural Nebraska, we have correction lines because the world isn't flat from time to time. And so this is not going to be a straight road. It's going to turn, especially in an exponential growth curve. So you cannot use ventilator supply as your main indicator. You have to use ongoing infections as your main indicator about whether you can open up or not. And our problem, of course, we know the cat's out of the bag in Smithfield. They are doing some things to try to minimize it, but it's already happened, so it's a little bit too late. And the reason I know it's too late, this is from one of our physicians yesterday. He said, since I last emailed you, I had one more patient who works at Smithfield positive. The husband of my previous Smithfield positive is also positive. The wife of another Smithfield employee came back positive, and a woman who's a patient whose son-in-law and grandson work at Smithfield, they're also positive. So it's not only the Smithfield employees, it is now also the Smithfield employees' families, and that's how it may be spreading into our community because a lot of those people do live in Lincoln, just like this Lincoln physician emailed me yesterday. So what happens is, that Smithfield employee might live in this apartment building and they may have infected his kids because they live together and the kids may have played on the playground. And if those other kids also played in that same slide like their kids, they got in contact and brought it back to their home, to their parents. Hopefully the spouse doesn't work at the food service at a nursing home, for example. When I do know one that was the case, we know that the spouse does work in a food service at the nursing home. Also, those people may have been shopping at the grocery store or at the hardware store. Were they wearing masks like this people, or weren't they wearing masks? Well, unfortunately, we're seeing a lot of people not wearing masks. And if those people not wearing masks were the family members of that Smithfield employee, they just now exposed everybody else who was not washing their hands and also not wearing a mask. So this is why right now we're in this community spread, because it went from the Smithfield employee to their family. Now it may be going out to the community through them. So it's even more important for you to do your part and wear your masks. So every little decision along the way is the difference between this kind of spread and this kind of spread. So this is somebody not washing their hands, somebody not wearing a mask. We need to make sure that people are paying attention and doing this. So how do you live in a pandemic? Well, number one, you wear a mask. I don't understand the civil disobedience about not wearing a mask. You're not wearing a mask just to protect you. You're doing it to protect everybody else. You're doing it to prevent killing other people. It's be like, okay, maybe I have a right to have a gun, but I don't have a right to gun to start shooting randomly when I'm walking downtown. That's equivalent to not wearing a mask. So wear a mask. You need to maintain that 6 foot spacing because the spread on droplet spread, and the droplets drop. That's why 3 to 6 feet usually is good. So if you're at least 6 feet away, you should be fine. Small groups, not a church. I've already talked to my pastors about that. Outdoors is safer than indoors because it'll disperse faster, and then wash your hands because some of it's spread on contacts like this. So this is me in a mask at the grocery store. This is me in the mask going to get my mulch. You guys should all be doing the same thing. It'll protect both you and the whole community. And literally, this was what would help us open up faster. So if you want to open up, put on your mask. So when to reopen? Again, I don't know how many times we have to say this. One, we have to be able to test everybody, which we aren't quite there yet still, and we need a sustained reduction for 14 days. We're actually on the increase, not on the decrease on that one, and we still need to have a plan to have to monitor this when we open up, which also still hasn't started happening yet. So, and enough with the conspiracy theories. These guys, I think, have hopefully been thoroughly debunked by just about everybody out there. There's a new one about pandemic. It's so bad, I'm not even going to comment on it. So quit it with the conspiracy theory stuff already. A couple myths I'll just go through because I hear these over and over again. So myth number one, more new cases is just because we're testing more. Yes, that could happen, but if that were to happen, what you would see is the percent of test positive wouldn't be changing. And so Raju puts this section right on the Lancaster County website. What you'll see is the percentage positive was 2%, now we're at 16%. So if it was just increased number of testing, this would have stayed similar at 2%. It is not, it's up to 16%. So most of those new cases are not because we're testing more, it's because we have more people to test who are positive. And so don't be lulled by this, oh, it's just because we're doing more tests. That is not the main case. We've had some increase in tests, but not that many, but the percent positive is going up dramatically. Also, if you look at the RT website, Nebraska is number one on spread, so it is spreading rapidly in Nebraska. We're competing with our Big Ten rival Minnesota to see who can have the fastest spread. This is not a competition we want to win. We're winning this competition for the same reason. For them, it's also meat processing facilities. Myth number two, deaths are up because they're being falsified. That is totally not true. It is true that hospitals could get paid more if they have a diagnosis of COVID, but they should because it costs a lot more to care for COVID. They're burning through tons of personal protective equipment that costs money, so of course they get paid more for taking care of COVID. But hospitals don't assign diagnosis or cause of death. Physicians do. And physicians can be fined or lose their license for falsifying medical records. They are not going to risk their good name and their medical licenses just to make more money for the hospital. That makes no sense. Now, are there some mistakes being made? Of course. It's a mad scramble in New York. They're not going to spend all their time and effort just to verify exactly 100% that every death is exactly right. You just have to be close in this game. The real way to monitor this, if you're not sure about all the diagnoses, is to follow something called excess deaths, excess mortality. So here's the excess mortality. So this is actually the CDC going back several years. They know how many people die every week on average, and they have a threshold for when it looks like it's above average. This is one of those bad influenza epidemics. And then you see a little blip there. So that's a bad influenza epidemic. This is coronavirus. You can see not even close here. This is so much bigger than this one. This is coronavirus, and it's just getting started, by the way. This is an average across the entire country, and there's places in the country where it hasn't started yet, and there's countries where it's out of hand. So if you want to look at comparison to XX deaths over baseline, here's New York. It barely fits on the page. New Jersey, and then we will be coming next. So you'll probably see this keep going up, and the excess mortality is far more than expected. In New York, actually, the COVID deaths are more than all of their deaths combined. It's not just the number one cause of death, it's more than all the others put together: gunshots, heart attacks, strokes, everything. So our excess deaths are not made up. This is true. Myth number 3, I can get an antibody test, then I'll know I'm safe. This is wrong. Do not buy an antibody test right now. Here's why. Number 1, antibody tests aren't validated for accuracy yet. And so there's no FDA lab making sure that the company selling this isn't full of it, basically. The test may not be specific to this coronavirus. There are multiple strains of coronavirus, and do you know that you're immune to this coronavirus or the common cold coronavirus you got in November? That will not tell you that. The other big mistake that I keep seeing over and over again is 98% specificity does not mean 98% accurate. To know how accurate it is, you also have to know how many people are both infected and uninfected in your town, which we don't know that. If we assume that only 10% of the cases have been counted so far, even then the test is going to be more wrong more often than it's right. So right now we're almost up to 500 confirmed infections. So even if we are only catching 10% of them, that's 5,000. The false positives for uninfected people will exceed the number of actual positives. So if you got this test right now and it said it's positive, chances are it's wrong. So it would give you a false sense of security. So do not waste your money on this test right now. This might be helpful for a population level, but it is not ready for prime time, so don't waste your money on it. So again, we have to create a long plan. We need to have this all thought out. We need people to start to quit sharing the conspiracy theory stuff and start doing the right thing. Number one thing to do is when you're out in the community, out in places like the grocery store, put on a mask. So hopefully this is all helpful to you. As I've said before, this isn't necessarily the opinions of all the people I work for, but this is where I work, so you can know that I'm not one of those conspiracy theorists living in my mom's basement pushing this stuff out. I actually do have a day job and do real things. If you want to know where the other videos are, you can go to the healthylincoln.org website. They're all there. Hopefully this is helpful to you, and I'll probably do another one in another 3 to 4 days.